The province is switching its funding model for acute care and surgeries. It aims to be more efficient through activity-based funding, with healthcare providers receiving funding based on the number of procedures they complete versus a blanket check. The Alberta Medical Association is in favor, while others are concerned it may lead to private healthcare facilities going after certain surgeries to maximize profits. Tyler Barrow explains.
Alberta projects 310,000 surgeries will be completed this fiscal year in the province, up about 6,000 from last year. Yet it'll still be a while before Fran Hochhausen will have her surgery for her herniated discs. She's just hoping to get an appointment by September.
And then I go on a waiting list, and the waiting list is 3 to 4 years.
Hoping to get people like Hochhausen in sooner, the province is switching its funding model for acute care and surgeries to activity-based funding. The province will fund both public hospitals and private surgical facilities based on the number of procedures completed instead of blanket grants.
Funding will soon follow patients to drive more high-quality surgery for Albertans at lower costs.
The activity-based funding is already being used in countries like Australia and Sweden. It claims this will lower wait times, increase transparency, and attract more surgeons, ultimately incentivizing facilities to be more efficient.
Importantly, this creates a strong incentive for hospitals to provide their services in a timely way.
The new model is raising concerns. The Health Sciences Association of Alberta worries about the private sector cherry-picking the easier surgeries, and the Alberta Medical Association wonders about quality being sacrificed for quantity.
Guardrails to make sure that facilities are still doing those complicated cases.
Still, the AMA president says the new funding schedule could lead to a more efficient system, with hospital staff striving to get more procedures done.
It just depends how innovative they could be in terms of reducing costs,
which might get someone like Hochhausen in sooner for back surgery.
I'll believe it when I see it.
The funding switch will be active by 2026. Tyler Barrow, CTV News, Calgary.
In response to the new funding proposal, the NDP says the publicly funded healthcare system needs to be efficient, but it shouldn't be forced to sacrifice quality based on turning patients over quickly.